Hey guys, this is Matt for Creative. Now here's some news about the lockdown in California. So we're reading off the CNN article that I just saw here. So California orders residents to stay at home, that's the headline, and it says California Governor Gavin Newsom issued a statewide order Thursday telling residents in the most populous state to stay home. And what I think is really key, for a moment I forgot what day it was. I thought it was Wednesday, and then they said this is going to be, here, let's read this here. It is the most restrictive order by a governor so far during the novelist coronavirus pandemic. It applies to the state's 40 million residents, and there are some exceptions for workers in the 16 critical infrastructure sections. The order takes effect Thursday night. And there are more here, but what's really shocking is that I was thinking Wednesday, and I was like, okay, maybe that gives people a day, but today is actually Thursday, and that means that order goes into effect immediately, because right now it is 10:31, so what is it, 3 hours behind in California, so 6:31. That gives people no time to prepare, even though people have been dropping hints, suggesting things to stay away. Hopefully everybody has gotten everything they need, but let's read a little bit more about what actually what businesses can actually still work. So those that work in critical sectors should go to work. Grocery stores, pharmacies, banks, and more will stay open. Newsom tweeted, "We need to meet this moment and flatten the curve together." So when they talk about critical sectors, in my mind, not saying that any job is not a extremely beneficial job, but for some reason grocery stores never stuck in my mind as a critical sector. But of course, this is where people get their food. Pharmacies, of course, people need to get their prescriptions if they're already on something, or if they need to get something, that's what they need to do. Banks. Now that's an essential thing, because I heard for a long time now, because there are so many rumors floating, and I live in New Jersey, I work in New York City. We literally just closed our New York City store today, so that's some news for us. But I'm always thinking, what's going to happen in New York City, and will that apply immediately to New Jersey? Because I live about a 5 to 10 minute bus ride from Port Authority in Manhattan, New York City, so very close. I do travel across state lines every day, but it's I am in a separate state. But banks, for sure, I've been hearing that maybe the actual people inside the tellers may go away, but the ATMs may be filled, because that way people can still get their money. If they need to speak to somebody about something that's a little bit more in their I guess their banking world, they could give a call. But I know some friends who, I'm not sure if you know the concept, but they have a security box at banks, and that's something that they need to be let into. Some banks require the bank manager to have a key and you to have a key, so you can go inside and get maybe essential documents, something that's very precious to you. Now, if bank locations are closed, you would either be locked away from having those things, or you would have to pull them into your home. But in this case here, it does say that banks will still be open. Let's read a little bit more. It comes as the number of cases in California and the United States skyrocket. The rising toll has medical officials around the country looking at how to treat the deadly virus, but one of the nation's preeminent infectious disease experts told CNN on Thursday, there is no magic drug now. The number of reports of positive tests has gone from a few thousand on Sunday to more than 13,000 as more people are infected and more people with COVID-19 find out through testing that they have the disease. Now, this goes into rumor and speculation, and this point only. In New York City, it's actually very hard to get the test. I have a friend who they felt like they had flu-like symptoms. They felt sick. They tested negative for the flu. They tested negative for one other thing that I can't remember. And they were thinking, okay, if I'm testing negative for this, let's get that coronavirus test. And that's something that they would not allow them to get. And that's the way that they worded it. And that's odd. That's very odd, because there's one thing, hey, we don't have it, we can't give it to you, it will be coming, but to just outright say you're not getting this right now is something that I find concerning. I've heard some people say they want to keep the visualization of the numbers down, so they are not letting everybody to take that test, or else maybe that may cause a panic. I feel like this is something that people need to be eased into, but knowing or not knowing if you have this virus is key. So I think this is one of those things where you may have to trade a little bit of panic, and maybe that would help people help themselves by forcing them to stay at home. Oh, I have it. Maybe that's not like a huge bad thing for me, but that definitely means for me to stay at home so I don't infect other people, because there are so many people not following the directives and suggestions to stay at home. They're still going out, they're still going in group areas in New York City and other states. I still feel like everybody should have the opportunity to have this test, especially for somebody who has a fever and flu-like symptoms. I feel like they should have this test, but again, maybe this is just something that's not available right now. Maybe there's some other reason. That's some speculation that I just want to let you know what my thoughts are on this. Let's continue a little bit here. In a news briefing Thursday, President Donald Trump said that he had pushed the U.S. Food and Drug Administration to eliminate barriers to getting therapeutics to coronavirus patients. Trump said the anti-malarial drug, I can't even say that, chloroquine, and its analog hydrochloroquine would be available by prescription to treat the novel coronavirus. Now, I know for not a fact, I don't believe there is a vaccine currently on there. So what would this do here? I just want to see if you can actually read that. It's not going to blow out the camera. There we go. So I don't know if you know these words here, just that's what it is. Dr. Anthony, the director of the National Institute of Allergy and Infectious Diseases, said the two drugs would be made available, but there needs to be a way to see how safe they are and whether they work to inhibit coronavirus. So that actually leads me to a separate thing. I believe the World Health Organization and the Prime Minister of France came out yesterday, which was Wednesday, the 18th, March 18th, saying that ibuprofen is something that may accelerate the growth of the bacteria. In any way, whatever the wording was, they said that it was not something that you should take for anybody suspected of having coronavirus. And the thing is, they use a lot of words like after hypothetical testing or after some research has been done. Nothing is finalized with this. Oh, my light went out. Let's get that back on. Nothing's been finalized with this. So saying things like, oh, there's a hypothetical, there's a lot of things like this, it's something that, who knows? Like, who honestly knows? It's something that you have to get concrete down before laying it all out there and saying that, why is this not going back on? Saying that something is good or not good, or okay to use or not okay to use, because people were actively going against getting ibuprofen, and they were moving, and actually, because this was in Europe, they were actually moving to things like Panadol. That's their alternative to ibuprofen. For us, you can get Panadol imported here, but more likely it's going to be acetaminophen, and that is going to be, oh, I'm sorry, I misspoke. So for us, that's going to be Tylenol. Tylenol is acetaminophen. There's also generics and other ways you can take that. In Europe, Panadol is the brand. Paracetamol is the recommended medicine that you're supposed to take instead of ibuprofen, which is in Advil and other things too. So just to be sure, you have to do your research before putting this stuff out there. Because again, they put that out as a recommendation because maybe that'll help, because maybe you have both. Maybe use one or the other, but in the long run, it's just kind of concerning to to not know if something is going to affect you or not. Now again, this is more rumor, which I'm going to be talking about right now, but I don't know if you know anything like elderberry. I did hear from some sources that elderberry is not something to take and that can also accelerate the growth, but I only saw that maybe in one thing, and the story did not get picked up. So when something doesn't get picked up, in a case like this, now usually this is going to be me with theories and me with a bunch of stuff. But usually if a story does not get picked up during normal circumstances, it could be something that's trying to be quelled, or that is just not interesting enough or factual enough to be carried by a lot of major news outlets. But I think right now, if a story isn't carried concerning this virus, it just is something that's either not factual for sure, or just extreme speculation. Because right now there have been some people that, let's say, I think they were trying to hack the CDC's website and impede and maybe try to gather information on the coronavirus and the people that may have it, may not have it. But I think right now everybody is trying their best to stop this in one way or another, either by a lockdown or a shelter in place or anything like that. I think people are trying their best to make sure that we are all okay. The time for misinformation can be left for things where maybe it's things like politics or business or point of view. This is definitely one of those times. I believe whether you take this seriously or you don't take this seriously, I would always err on the side of caution, to make sure that you pass along the right information. When it is speculation or rumor, to state it as such. I know that you don't have all the time in the world to actually do this kind of research. Everyone can't do that. People do have things to do. People still have jobs to go to. People have lives to live. But when you research something, make sure you do it right. Make sure you check your sources. Make sure you check multiple sources before you I was going to say spew it online, before you share it online. I think it's probably the best to do. But yeah, so that is the key information that I have. It's news that I thought was very important to share, meaning because I live in New Jersey, work in New York City, I believe that that's a precursor to showing what is going to be happening soon. So again, California orders residents to stay at home. Let's see if there's anything more. Statewide order on Thursday. Reported tests. It doesn't say how long this is going to take. No magic drug. This is what we had before. So what I'm going to do is try my best. Yeah, because there's so many things to go over. Let's see, state measures to combat shortages. Interesting. So a little side note, New York City is mentioned, which is relevant to me. So it says state measures to combat shortages. New York City is 2 to 3 weeks away from running out of some medical supplies, according to Mayor Bill de Blasio. He said Thursday that the city needs 3 million N5 masks. I believe that those are the ones with the little filter, sometimes made by 3M. They are the masks that go around here, but they do have a filter. They're not just the paper surgical masks to prevent you from spreading. That's to actually prevent you from inhalation as well. Let's see. They need 3 million N95 masks, 50 million surgical masks, and 15,000 ventilators. Additionally, the city needs 25 million surgical gowns, coveralls, gloves, and face masks. People need a lot of stuff right now. I say this a lot, it's going to be tough. I don't believe there was anything mentioned in here in this article about how long this lockdown would be, but I imagine you're going to get more and more information, and when I get more, I will be sharing it with everybody here. I know that this is just another way to get your news, because you can easily read CNN, Business Insider, Fox News, anywhere that you choose to get your news from. You can definitely get it from there. But this is always going to be the news with my take on it, and speculation and rumors. And I will try my best to associate each under a tag. Like when I think something is rumor, I will state it as such. When I think something is speculation, I'll state it as such. And when well, it's not if I believe, fact is fact. When I see it being referenced by multiple news sources, that's when it becomes news. I will then inform everybody that I can. But alright guys, if you want to begin a dialogue with myself or have any questions, you can put that in the comment section below. You can find me on Instagram at m8b9. You can email me at matt8b9@gmail.com. And I'm making these videos regularly on news, politics, and just about New York life and New Jersey life in general. So guys, I will see you soon. Thank you so much for watching. Bye-bye.